Can oxidative stress impact stroke outcomes? Have you ever wondered how oxidative stress might affect stroke outcomes? Well, it turns out that oxidative stress plays a significant role, especially in acute ischemic stroke. This condition occurs when blood flow to the brain is reduced, leading to brain damage and influencing recovery. Oxidative stress arises when there is an imbalance between reactive oxygen and nitrogen species and the body's antioxidant defenses. This imbalance can lead to cellular damage, affecting lipids, proteins, and even DNA. Research shows that oxidative stress is a key player in the pathophysiology of ischemic stroke. After a stroke occurs, excessive production of reactive oxygen and nitrogen species can damage brain cells and trigger inflammation, worsening the injury. Studies have consistently demonstrated that higher levels of oxidative stress are linked to greater brain damage and poorer recovery outcomes. One way to measure oxidative stress in stroke patients is through biomarkers. For instance, malondialdehyde is a product of lipid peroxidation and is often elevated in individuals who have had a stroke. Higher levels of this biomarker shortly after a stroke correlate with greater severity and predict worse functional outcomes 3 months later. Another marker, F2-isoprostanes, can indicate the risk of complications like hemorrhagic transformation in acute ischemic stroke. Antioxidant defenses in the body are crucial for managing oxidative stress. Enzymes such as glutathione peroxidase and catalase help neutralize harmful reactive species. However, studies have found that these antioxidant levels are often reduced in stroke patients. Lower activity of these enzymes is associated with increased oxidative damage and worse outcomes after a stroke. The impact of oxidative stress doesn't stop in the acute phase. It can also affect long-term recovery and disability. Persistent oxidative damage may hinder the brain's ability to repair itself and recover function. This highlights the importance of addressing oxidative stress not just immediately after a stroke but also in long-term rehabilitation. There is ongoing research into therapeutic strategies that could modulate oxidative stress as a means of neuroprotection in stroke patients. Antioxidant therapies, whether through medications or lifestyle changes, are being explored to reduce oxidative damage and improve outcomes. However, it's important to note that while these strategies show promise, they are not yet standard care, and more clinical evidence is needed. Interestingly, emerging studies suggest that gut microbiota might also play a role in influencing oxidative stress and neuroinflammation after a stroke. This opens up new avenues for potential interventions that could help manage stroke outcomes. In summary, oxidative stress is a critical factor that influences the severity of ischemic stroke and recovery. Elevated markers of oxidative stress are associated with worse outcomes, and impaired antioxidant defenses can exacerbate brain injury. While there is potential for antioxidant strategies to improve prognosis, current clinical practice emphasizes established treatments for acute strokes. As always, it is essential to consult healthcare professionals for personalized advice and treatment options.